Hi everyone. Before going through this video, kindly go through the growth and development of toddler and preschooler in the previous video for better understanding of this video. In this video, we will be seeing growth and development of schooler and adolescent. Schooler is in the age group of 6 to 12 years. First, we will be seeing the vital signs. Temperature 36.5 to 37.5 degrees Celsius, pulse 70 to 110 beats per minute, respiration 15 to 30 breaths per minute, BP 85 to 120 by 55 to 80 mm of Hg. There is a formula for calculation of BP for 7 to 12 years, that is, systolic is 2 into age in years plus 82 by diastolic age in years plus 52. So for this particular age group 7 to 12 years you can use this formula. In the previous age group also till 7 years toddler and preschooler we had another formula. Kindly go through that formula also. Anthropometry. Here for a schooler we will be checking height, weight and mid-arm circumference. Weight is 20 to 25.5 kg and height 113 to 125 cm. The mid-arm circumference is 17 to 18 cm. The formula for anthropometry is weight is equal to age in years into 3. Height in centimeter is equal to age in years into 6 plus 77. In the previous video also I have told how to calculate the degree of malnutrition. That is actual weight divided by expected weight. Expected weight is found out by using this formula into 100. If the value is below 90%, the child is having a risk of malnutrition. Sensory development. The visual acuity is 20 by 20. The child is having good vision. Teeth starts to lose temporary teeth and acquires first permanent molars, that is the central incisors. So you can see the central incisors are the first teeth to come. Language speech development. There are two types of language, receptive and expressive language. Receptive language is what the child understands. Follows a series of 3 commands at a time. Response depends upon the mood of the child. Responds to praise and recognition. You have to keep in mind a schooler at this time. You know that schoolers will be having mood swings and they like to be praised and recognized. Expressive language. They can repeat sentences of 10 to 12 words, have a good vocabulary of about 2500 words, uses all forms of sentence structure. You know that this is the reason why you will be teaching active and passive voice and all the tenses in the school. Knows number combination and how to do the mathematical calculations. Develops a sense of humor and enjoys telling jokes. Safety and love need. Safety and protection from drowning, burns, accidental poisoning and bodily injury. Love and affection, immunization, hygiene. Parents need to be taught about all this safety and love needs. And also the second thing which parents need to be taught is nutrition and sleep need. They should get iron supplementation, especially girls. The calorie, protein, water, iron, calcium requirements, as a nurse we need to teach the parents. The schoolers need to get 10 hours of sleep. About the play needs. They like more active play and skill play. They enjoy dramatic play, likes rough play, prefers group play. If you are seeing all these pictures, you will be able to understand all the different varieties of the plays they enjoy. So what we need to provide? We need to provide table games, board games for competitive and team play, bicycles, jump ropes, punching bags, roller skates, balls and bars, gymnastic equipments for motor activity, puppets, dolls, paints, crayons, drawing materials, clay, magic tricks, dance lessons, musical instruments for creative play, books, puzzles, records, tapes, collectibles for quiet play. So as parents need to provide all these things for the requirement of a schooler. Gross motor development. Rides bicycle without training wheels. There is no need of the side wheels. Runs, jumps, climbs and hops. Constantly in motion. Clumsy and awkward activity also you can see sometimes from the schooler. Coordination is improving. Fine motor development. They know right hand from the left hand. Draws a person with 12 to 16 parts. Prints words. Learns cursive writing. Has improved eye-hand coordination. About the feeding skills, they likes to eat with fingers. Sometimes in the initial ages they stuff food into their mouth. Later on there is an improved table manners for the schooler. They are initially in the schooler period talkative while eating, and later on when they learn the table manners they will keep quiet while eating. They are more interested in eating at the beginning of the meal. Other skills like grooming, dressing and toileting skills. Self-care is managed by them, may need some help with dressing, wears whatever is selected by parents, leaves clothes where they are removed. Even in front of the bathroom you can see them leaving their clothes. Can brush and comb hair. This point, wears whatever is selected by parents, is an important point to remember in schooler because at adolescent age you can see a difference. Psychosocial or emotional development. Sense of industry versus inferiority. This is seen in 6 to 12 years. Sense of industry. Industry is an area where more production occurs. So like this in school period, the child is more industrious. They are more productive in their life. Continues to be egocentric, bossy and has a know-it-all attitude. They always crave for attention. They insist on being the first in everything. Sometimes they use verbal and physical attack. Some may go for chewing on the hair or nose picking. Most of them will be having good days and bad days. Wants other children to play with. They are jealous of siblings and fears injury to body. Psychosexual development. The child is in the latency stage 6 to 12 years. Latency stage means the child is not interested in the sexual activities. The sexual energy is sublimated to schoolwork, hobbies and friendship. They have forgotten the sexual part. Moral development. Conventional morality. They are trying to be good persons and oriented towards rules or social orders. They like to obey the rules in the school. Cognitive or intellectual development. Concrete operational stage is 7 to 11 years. The attention span increases. They can describe objects which are given in pictures and they will be knowing the use of that particular object. They have cause and effect understanding, why something happens. Can see differences more than similarities. That is why spot the difference games we will be providing for this age group. They perform mental operation of conversion of liquid to gas and solid. and vice versa. And they know the amount of matter which is contained. They can tell time, they know about the date, month and season. They are learning to read. They follow rules to avoid punishment. These are all their cognitive development. Spiritual development, it's in the mythic literal faith. Often give humanistic qualities to God at this time and believes heaven and hell are actual places. Now moving on to the growth and development of adolescence, that is 12 to 18 years. Vital signs: temperature 36.5 to 37.5 degrees Celsius, pulse 60 to 106 beats per minute, respiration 12 to 20 breaths per minute, BP 95 to 140 by 60 to 90 mm of Hg. It has reached the adult level now. Anthropometry, weight is 49 to 53 kg, height 149 to 153 centimeter, and mid-arm circumference 18 to 21 centimeter. There is formula for anthropometry here. Weight is equal to height in centimeter minus 100. And height for girls is height at 2 years into 2. And height for boys is height at 2.5 years into 2. If you know a child's height, a girl child's height at 2 years, you will understand their adolescent height. And if you know the boy's height at 2.5 years, you will be able to understand the adolescent height. It is to be multiplied by 2. Sensory development, visual acuity is 20 by 20 and the teeth eruption of second molars is there. You can understand the different teeth eruption ages with the help of this picture. Secondary sexual characteristics. This is Tanner scale which is shown here, which shows the secondary sexual characters of females and males. Generally, you know that in males the voice becomes much lower or breaks. The hair is seen in the chest, face, under the arms and in pubic area. The penis becomes larger. The body becomes more muscular. And in females, you know that the breast and nipples grow and enlarge. Hair develops under arms and pubic area and hips become wider. So that is general, and with the help of the Tanner scale you can see the stages are classified into 5 for both females and males. You can see the development of breast in each stages and pubic hair development in girls in all the 5 stages. In the males also the genital organ development is shown in 5 stages and pubic hair development in the 5 stages. Language and speech development. Children in the adolescence uses slangs within and outside peer groups. Use distinct meaning for words. You can hear words like dude, buddy, all these things in this age group. Safety and love needs. Safety and protection from motor or non-motor vehicle accidents, drowning, burns, poisoning, bodily damage and falls. So parents as well as adolescents needs to be instructed about all the safety things. And about the love need, adolescents need more love and affection, their immunization need attention, hygiene, they need independence from parents. Peer influence and acceptance is very important at this age group. Peer relationship becomes very important. There is a need for long-term commitment in relationship. Nutrition and sleep need. Food, about iron supplementation, you need to tell the parents. The calorie requirement and protein requirement for males and females are different. Males require more calorie and protein. Water requirement per day 50 ml per kg per day. Iron and calcium requirement is different, so you need to teach parents about all these things. The sleep required is 8.5 hours per day. Now moving to the play needs of adolescent. They are the dreamers. They choose activities according to individual interest. They like parties, show interest in conversation, helping others, expressive arts. They develop hobbies, learn crafts, and develop the habit of social drinking and drugs sometimes. So, play needs, nutrition and sleep needs, and safety and love needs more concentration from the parent side also. Gross motor and fine motor development. Clumsiness occurs due to rapid physical growth. Motor function is almost comparable to that of an adult, and there is a good hand-eye coordination, and it has reached the adult level. That means the gross and fine motor development is at the topmost level for an adolescent. Psychosocial or emotional development. There is a sense of identity versus role confusion in the adolescence. Sometimes they hear the parents say they are grown-ups, so they have to behave like an adult. Sometimes they listen from the parents, they are just kids. So the children are having identity and role confusion at the period of adolescence. Psychosexual development. This is the genital stage 12 to 18 years. Here again the energy is concentrated on the genital organs. So that is why opposite sex attractions will happen at this time. Moral development. Post-conventional morality. So this is the age of a law-making perspective. They feel like some laws in the society are not correct, so they need to reform. The individual conforms to maintain others' respect. They respect each and every person in the moral development stage. Cognitive and intellectual development, that is in the stage of formal operational stage. That means the child likes to generate hypotheses. That is, they go for logical thinking and logical reasoning. They use the scientific method for problem solving. So the cognitive development is at the highest level. Spiritual development. Synthetic conventional faith. They extending faith beyond the family. Now they can start to see the contradiction, but questions are silenced. They appreciate others' viewpoints at this age group. So that is about the growth and development of schooler and adolescent. Hope you understood. Go to the patients with activities and communicate more to the patient to understand their growth and development. And whenever you are dealing with an adolescent, try to give more privacy to them. Please do subscribe to this channel. Thank you.